The administration of President Donald Trump is examining whether it has the authority to remove children's hospitals from the Medicaid program if they perform gender reassignment surgeries on patients under the age of 18. Mehmet Oz, the well-known doctor appointed by President Trump to lead the Centers for Medicare and Medicaid Services, sent a letter to 9 children's hospitals requesting data on sex reassignment surgeries, hormone therapy, and puberty blockers. President Trump has been clear. America will protect kids from life-altering and experimental procedures, Oz stated. The Centers for Medicare and Medicaid Services has warned hospitals and state Medicaid programs about these dangers and is taking regulatory enforcement actions. The letter set a 30-day deadline for response, which has since passed, prompting the administration to explore ways to cut off funds to these hospitals, according to the Wall Street Journal. While the letter did not specify any particular actions against the hospitals, officials from the Centers for Medicare and Medicaid Services indicated to the Journal that they believe they can halt funding for gender treatments for minors through Medicaid and marketplace insurance plans. The agency is also considering whether it can entirely remove these hospitals from Medicaid if they continue providing such surgeries, as reported by the Journal. The Daily Beast has reached out to the Department of Health and Human Services for comment. Hospitals in Boston, Los Angeles, and Seattle have informed the Centers for Medicare and Medicaid Services that they intend to respond to the letter, but have not yet done so, according to sources cited by the Journal. 2 other hospitals in Colorado and Ohio also plan to respond. The letter has placed these hospitals in a difficult position because many children's hospitals rely heavily on Medicaid for funding. Children's Hospital of Los Angeles receives 65% of its annual revenue from federal sources and was compelled to close its gender-related care program in response to the Trump administration's threats, as reported by the Journal. Otherwise, it faced the risk of shutting down entirely. The hospital has been left with no viable path forward, hospital leaders wrote in a letter to staff dated June 12. Other hospitals are being forced to navigate complex legal issues. In January, an executive order was issued by the White House stating that the United States would no longer fund, sponsor, promote, assist, or support the so-called transition of a child from one sex to the other. However, some state laws, including those in Massachusetts, require hospitals to provide gender-affirming care. We uphold this responsibility with the utmost seriousness, a spokesperson for Boston Children's Hospital told the Journal. The hospital is still reviewing the recent letter from the Centers for Medicare and Medicaid Services. The Daily Beast has inquired with the Department of Health and Human Services about what legal authority might allow the Centers for Medicare and Medicaid Services to remove hospitals from Medicaid despite state laws, and whether this authority could extend to other politically sensitive medical issues such as abortion.